This presentation reviews how overlap between cases and controls can be improved in stratified covariate balancing. This brief presentation was organized by Dr. Alemi. The problem with this stratification is that as the number of covariates increases, fewer and fewer cases and controls match. As the number of covariate increases, the number of cases per stratum decreases, and combinations of covariates become quite rare. In these circumstances, it is possible that a large portion of the cases may not have a matching control, and therefore are not used, reducing the generalizability of the findings. Percent of overlap reports the percent of cases that are matched to controls. In this equation, C is an index to cases, and MC is 1 when the case is matched to a control and 0 otherwise. The parameter QC indicates the percentage of covariates in the case that were matched to the controls. If in the case all covariates were matched, then QC is 100%. Note that the percent of overlap does not depend on controls that were not matched. The intent of the analysis is to examine the effect of treated patients, thus what matters is matching to the cases. Unmatched controls don't affect the treatment effect and therefore can be ignored. When the percent of overlap is low, for example lower than 80%, then findings cannot be generalized as many cases are not matched to controls. The remainder of this lecture discusses how one can reduce stratification, increase overlap between cases and controls, and improve the generalizability of stratified covariate balancing. We discussed 3 strategies. The first is to modify the case so a partial match can be made. This approach calculates the outcome for the modified approach using expected values. The second approach is to use parents in Markov Blanket of treatment to identify irrelevant covariates and drop these covariates from the analysis. The third approach is to add in new synthetic controls. The first method we discuss has to do with altering the case and its outcomes to levels that can be matched to the controls. In this method, percent of overlap is increased by partially matching the covariates among the unmatched cases. The unmatched case is altered to the largest portion of the case that matches to at least one control. The matched covariates are referred to as a shared component. The outcome for the altered cases is said to be expected outcome for all cases that share the common component. For example, suppose a male 70-year-old patient with walking disability has no match among the controls. The closest match we can find are male patients with walking disabilities. Then the patient's age is dropped from the analysis. The outcome for the new case is the average for all male disabled cases, which includes individuals in different age groups. This new case is matched to male patients unable to walk among the controls. The outcome is changed to the expected value associated with the shared component. The percent of overlap is improved in these cases by the portion of covariates matched, in this case by 2 out of 3. The second method of improving overlap is to drop irrelevant variables through identifying parents in the Markov blanket of treatment. Markov blanket of treatment is a set of covariates that block the effect of other covariates on treatment. The Markov blanket includes parents, children, and co-parents named for direct causes, effects, and direct causes of effects respectively. Parents in the Markov blanket are identified by focusing the analysis on independent variables that occur prior to treatment. In electronic health records, healthcare events are time-stamped, and it's relatively easy to identify what has occurred prior to the treatment. Obviously, age, gender, and demographics are set at birth, so they occur prior to the treatment. Medical history and comorbidities also occur prior to treatment. Many algorithms for identifying the parents in Markov Blanket exist. Here we focus on one of these algorithms that uses lasso regression. Lasso regression is a type of regression that limits variables that have a statistically significant impact to those that have a large effect size. Prior to conducting the regression, we exclude covariates that occur after treatment. This step removes covariates in causal path from treatment to outcome. For example, complications of treatment are excluded from the list of independent variables. Next, the treatment variable is regressed on independent variables that occur before the treatment. For example, patient demographics, medical history, or comorbidities. Parents in the Markov blanket consist of covariates that A have a statistically significant impact on outcome, and B have an effect size greater than a preset cutoff value. Stratification focuses on parents in Markov blanket and ignores other covariates. The procedure allows us for matching to relevant covariates and ignoring irrelevant variables. It has been shown to reduce the number of covariates by 3 to 4,000 fold depending on the number of variables in the initial data. The third method of improving overlap is to add synthetic controls. The approach is similar to the idea of oversampling rare events. It tries to add in from existing sample what might have occurred for missing controls. The analysis is not done on all of the data. It focuses only on control patients because the missing controls must reflect the pattern of outcomes among the controls. Missing outcome for the control case is estimated from a model of the data, usually using regression or two nearest cases. In these models, it's important to take into effect interactions among the covariates. The model is used to predict the outcome for the missing control by evaluating the model at covariates in the unmatched case. For example, suppose that the male 70-year-old resident who is unable to walk is an unmatched case. We need to look for a control that would match this case. Also assume that for control patients the outcome survival rate is predicted by the equation shown here. Now that the predicted outcome is available, the case can be added to controls and analysis repeated with the synthetic controls matching to previously unmatched case. The take-home message is that different methods exist for improving match between cases and controls.